my goodness, I need to write about this. People need to understand what you go through, what changes you go through as you learn how to become a doctor. And not all of those changes, by the way, are like wonderful, yay, amazing me. A lot of them are really about accepting humility over and over again in multiple different ways.
Welcome to Perpetual Motion with Dr. Mo Anderson. I'm your host, Dr. Mo, best-selling author, award-winning podcast host, keynote speaker, and speaker coach. My goal for every episode is to elevate, educate, and motivate you personally and professionally. Joining me today is a healthcare provider who says many people do not recognize how deeply the doctors who care for them may be suffering. Dr. Clara Unis is a board-certified practicing pediatrician who brings her love of writing and helping others to her other career of educating fellow clinicians on how to avoid burnout.
You can't say Dr. Mo ain't tell ya that fear magnifies the consequences of failure. What are you scared of? Why are you afraid? I'd rather live like I'm dying than live to die. Any day, my heart is pure, my soul is safe.
Hi, Mo. Thank you so much for having me on your show.
Hey, welcome, Clara. Excited to have you and this important topic because I think we saw it a little bit in 2020 because it was in our face quite a bit, but this is an ongoing problem, something that you're addressing, and certainly something that we need to raise awareness about. Let's start with your journey to become a physician. What made you choose a career in medicine over other options?
Boy, that's a great question. And one I think every doctor has a slightly different answer to. Mm-hmm. I certainly, from a very young age, enjoyed taking care of people and animals and just about any living creature. I just derived a lot of satisfaction over being a helper in some form. Mm-hmm. And so I think I thought of medicine as a way to do this in an not controversial way. And I say that because in college, I got very involved with all kinds of different causes. Mm-hmm. And I discovered that I really didn't want to stay in anything political for very long. So medicine seemed like an obvious way to be helpful and matter to people and maybe stay out of public controversy.
You make a good point. You make a good point. Other than Dr. Fauci, I don't think I've ever thought of a healthcare provider in a political way. And even him, he worked for an administration, but I didn't really think of him as being red, blue, green, or any particular way, just a fact teller and fact finder. So yeah, I like that. And are you happy with the choice you made?
Well, that's a complicated question, and that's loaded. Yes, overall, I am happy with the choice that I made. However, and I wrote about this a little bit in my book, I'm not sure I would encourage my children to make the same choice because I think medicine has changed quite a lot in the, couple of decades since I started my medical journey.
Absolutely. Healthcare has. And I was talking to some fellow dentists the other day about the changes from electronic health records to imaging to just patients' expectations and the benefits. It's a lot. So I get that. I really get that. Well, I'm glad you made the choice you made because you're in a position to help physicians in a way that others might not be able to with that shared background. And we're going to talk about your book as well and the many other wonderful things that you do. But first, if my notes on your bio are accurate, you earned an MFA, Master of Fine Arts, while also attending medical school. That is amazing. That is really amazing. We're going to talk about why, but I just need to know how you did that. Those two arduous programs at a young age. You must have had amazing time management skills before we were even talking about that.
Well, I have to say, I did not set out to get 2 degrees. I was in medical school, and medical school was quite an emotional as well as intellectual journey for me. Mm-hmm. And as I was going through it, I was thinking the whole time, my goodness, I need to write about this. People need to understand what you go through, what changes you go through as you learn how to become a doctor. And Not all of those changes, by the way, are like wonderful, yay, amazing me. A lot of them are really about accepting humility over and over again in multiple different ways. But as I was going through it, I just felt like it needed to be recorded because I knew that by the time I finished, I would no longer have the same perspective and I wouldn't be able to go back and write about it in the same way. So I looked for a writing program that was geographically close by that I could ride my bike to so that I would have that accountability. So I wasn't intending to get 2 degrees at the same time, but the way it worked out was in order to write about it and have assignments, because without assignments, I knew I wouldn't get the work done. I ended up enrolling in that degree program and then realized, of course, that I would have to spread out my last year of medical school. So I figured out how to stagger my clinical rotations a little bit with when graduate school got more difficult, so that I actually graduated med school about 6 months behind my class in December. And then 6 months later, I finished the MFA.
Wow, that is amazing. I know some people who took 5, 6, 7, 8 years to get 1 degree, and you're here laughing, saying I didn't mean to get 2. So I just need to give you some perspective on how remarkable that is. And there are many, many, many reasons, from, working to families to whatever, that people are unable to do one in that amount of time, even with the 6 months lag. So I don't want to take anything away from that amazing feat, even though you were clearly driven by our mutual love of words and language and literature. I just don't know that I could have tackled that in professional school. I mean, it almost killed me just having 1 child. So were you married with kids at the time?
No. And that's a really important point. I was unattached. I was beholden to no one but myself. My time was my own. And medical school teaches you to manage your time. It teaches you how to fit everything in somehow. Mm-hmm. So to add graduate school, because I spread out medical school, actually, those were easier years than the years I was doing just medical school. So it's perspective for sure. Understood.
I know professional school can be challenging. I mean, a lot of people burn out even there before they attain the degree. But you said that you started writing in medical school to retain your humanity. You told me that in a previous conversation, and I jotted that down because that just resonated with me. Will you tell us a little more about the connection between literary arts and medicine in your life?
What a wonderful question. I have always made sense of the world by writing. I find it to be the easiest form of self-reflection. And in general, it started with journal writing. I journaled all through medical school, but often it was like a little itty bitty square on the calendar where there were like 2 or 3 sentences that I wrote in this little cramped handwriting, but I wanted to record the moments. So it was my way to be like, you need to remember this, you need to remember that. And then later, when I was in the program, I was able to go back and try to make sense of these moments and understand what was happening to me as I experienced them. Now, literature is being used in many ways now in medicine, and in many ways, especially in training programs, in which we can use short stories to develop and work with empathy for others. So it can be used as a tool to practice how to closely listen to somebody, for example. So closely reading literature, closely reading a short story is not that unlike closely listening to a patient and really accepting or absorbing somebody's story. So the literature and medicine connection is huge. For me, it had more to do with my emotional journey and feeling like I was fully present emotionally, even when things were difficult in medical school, and even when I felt poorly about myself in medical school because of all that I didn't know or all that I had yet to learn.
Interesting. As you were saying that, I was thinking about storytelling also in explaining to a patient their diagnosis and treatment plan, because sometimes providers are so limited by a medical vocabulary that doesn't translate well with a patient who's not literate in that sense. Do you think that also can help providers, or has it helped you in relating to patients in addition to the listening, which is a great point?
I hope so.
Mm-hmm.
I think is my best answer to that. I remember going through medical school and being warned that this would happen, and us talking about how important it was to make sure that we didn't use medical vocabulary with patients. Mm-hmm. And then looking up over a decade later and realizing, oh my gosh, I just did that. So ideally, yes, that's true. And I think that also relies on some good communication with patients and patients having the comfort to speak up and say, I have no idea what you just said. Or
right.
Can you tell
Which
me
a lot
that?
of them don't, because a
lot don't.
You in such reverence.
Historically, yes. I would say there's less reverence than there used to be.
That was tactful.
Right. But there is still a discomfort with admitting to not knowing something. Everybody, every human has that discomfort, that fear of being found out. And so I think for that reason, people often don't admit or speak up if they don't understand something. And so that's where the communication coaching hat that I wear comes in as well, is realizing that there are ways to check for understanding too, right? So we can ask patients, especially if this is something complicated or difficult, we can ask them to tell us back, hey, I want to make sure I explained that in a way that made sense. Can you tell me what you understood? Can be a great technique for us to make sure that that communication really is going both ways and that we haven't totally flummoxed everything by throwing in medical terminology that is gobbledygook to patients.
Absolutely. And that doesn't just go for healthcare. I mean, I had someone here today working on my HVAC, and he was saying stuff. I was like, I'm cold. I don't want to be cold. Explain this to me like I'm a third grader. What are you saying I need to do? Don't turn them both. What are you saying?
Yeah, you're so right.
Yeah.
You're so right. I mean, car mechanics too. I mean, it happens in so many different arenas. And the communication consultant in me is like itching to be like, you got to explain it differently, dude,
Please. And for salespeople, they lose sales because they're so intent on impressing you with the words they know and the data and the statistics. So any of you who are communicating, you're getting some good tips here about how to connect with people in a way that will resonate and lead to some good outcomes, and they don't just leave and you don't know what happened with that. I'll call you back. I'll get back to you. And in your profession, it can be deadly if they don't understand what's wrong, why they need to take their medication, and the importance of follow-up. So what you're doing is I can see now a broader picture of that than even when I just read about it. And with that, you use the term narrative medicine. And I want you to explain that term and tell us what it adds to a medical career or medical life. Absolutely.
Narrative medicine is a field of humanities within medicine that I am so excited about. It was founded back in 2001 by a group at Columbia University who realized how much power lay in the ability to truly absorb narrative. So I think of narrative medicine as this quietly revolutionary field that is based on the concept of close listening. So part of what I was saying earlier about reading a short story closely, really paying attention to the elements of it and being able to absorb the story is similar to closely listening to someone. And that close listening isn't just hearing what they say, but it's noticing posture. It's noticing how they dress. It's noticing gestures or discomfort or whatever it may be. So that close listening is kind of the first step. And then through that, hopefully feeling like you have the ability to represent what has been told to you or represent it, really truly understand it. And through that, develop a close affiliation with that person. And when you have that closeness or you have that true understanding of the narrative someone is bringing to you, you then can act to be of actual service and actual help. I think of this as quietly revolutionary because, as you and probably everybody listening knows, there's been this huge push toward almost like speed dating in medicine, where you have shorter and shorter appointment times, and people are supposed to be able to get in and out of that office in 15 minutes with a complete history and physical and plan. And it's really not feasible when someone has anything complicated going on. Complicated could be family situation, could be the HVAC doesn't work, could be,
right,
any number of things. And so I feel like narrative medicine is kind of an antidote to this push to have medicine be practiced in a ridiculous rush, where it's much more of a consumer-driven field than it ever used to be. Like, I'm going to go to the doctor and get my antibiotics because I'm sure I have a sinus infection, as opposed to going to the doctor to be like, I don't feel right, and I want to hear what they have to say to me. I want to partner with my doctor to figure out what's the right thing. So totally different approaches to medicine. Narrative medicine is trying, I think, and in many ways successfully, to counterbalance the direction that medicine has been going for decades now.
That's a new concept to me, and I really like it. I like the way that you explained it. Thank you for sharing that. I do want to circle back to a point that you made there of patients coming in and demanding things. And I think they even already know what antibiotic they want because they've seen a commercial about it. And they say, ask your doctor, but it's turned into tell your doctor.
Yeah.
You're going to self-diagnose and come in and make a demand for whatever it is. And so this is in tying in with that question, how does that impact what you're trying to do as a healthcare provider when people are coming in with that posture of, I'm going to tell you what I need and what I want you to do about it?
Mm-hmm. It certainly takes time to sit down and understand where the demand is coming from, what they believe is going on, that has brought in that request. Sometimes it requires time to educate. Some people are open to being educated and some people really aren't. I think a lot depends on how we approach it. And I think a lot depends on the integrity of the clinician to feel that whatever we do offer is not counterproductive or not in the patient's best interest, right? So a classic one that's age old is the request for antibiotics for a cold, right? We know that it's not going to do any good if you have a viral infection and you're asking for something that fights bacteria. And yet some people come in very sure that that's what they need and want. So, often in the process of educating and discussing, I think the most important thing I could do is leave the door open so that, okay, well, if this does turn bacterial, I want to be able to have this available and I want it to work. But it's mixed success when people feel like they put down a copay because they're coming in to get one thing. And if we say no, and especially if we don't explain that no, it can really disrupt a relationship and it can make it very difficult to feel good about the kind of medicine that we're practicing.
That's a great point you make. And it's someone with a chronic health condition who sees a lot of specialists. And I don't always say, and they don't necessarily notice that I am in healthcare, and the way that they communicate with you, particularly when you're just asking a question. I think that's very fair for me to ask a question. I read about this. I saw that. I'm not telling you to do anything, but I want to know more about it. And it's just troublesome when they won't take the time to engage with you. But as you said, there's this push towards speed dating, and you've got, I don't know how many people on your schedule, and here's somebody wanting you to conduct a class. So all around, I think we have to be sensitive to how, each person on either side of that dialogue is feeling. I just want to be your patient. I want to come right now. I know you work on children, but I've been told I'm childlike. So
aren't we all sometimes? Yes, I mean, let's face it.
Yes, and I'm small. I think I'd fit right in. They wouldn't even notice. So yeah, I bet your patients just love you. You've got a great way about you.
Thank you.
What advice might you give those who are currently in medical school or considering it? You kind of said what you felt for your own children, but what about other people's children? What would you say to them?
Well, I mean, and let's face it, we're going to be in trouble in this country if we don't turn things around, because we're going to be driving people away from medicine. And we already are. I mean, I think the number of clinicians I know of who are leaving medicine for something non-clinical is incredible, and only increasing. So, we have a much bigger problem that needs to be solved. And I think anyone going into medicine has to have their eyes open that we have a system that requires changing, and it is probably not going to passively go the direction that we want it to. That said, I'm not sorry that I'm in medicine. And the reason that I can say that with such confidence is that I've been able to stay connected to my purpose in medicine. I've been able to take a step back and look and say, okay, what would matter as much as what I do right now that I have the skills to do? Let me back up. I don't have the skills to do everything, but medicine is a good match for my skill set and my desire to help people as long as I can work part-time. So I think that what's really important for someone going into medicine is that they find the time or the pastime that allows them to stay connected with who they are as they go through medical school, that they are not afraid to take a step back if they start to feel like they're losing themselves, which is what I did when I decided to go into the writing program. And that they are able to have someone to sound things off with if they're feeling intuitively like things are not going the way they want to, or they're not proud of who they are becoming. It's kind of complicated. When I went into medical school, before I started, I lived in actually where I am on vacation right now in Mammoth Lakes. And I am an outdoor enthusiast. So I mountain bike and I rock climb and I ski and I do all of the things outdoors. And my biggest fear in medical school was not getting outside. So the promise I made to myself when I started was that I was going to make sure that I was still able to get outside and still able to do these things. And it's absolutely possible to do that. Even when you're supposed to be studying all the time, you just get really good at scheduling your little time breaks. And I think that was critical for me to remind myself of who I am and what my passions are, as I was going through a really difficult time. And then, of course, writing was sort of the crowning piece of that, where I realized that although I felt like myself when I was outdoors, I also was not making room for the introspection that I personally needed in order to stay connected to my purpose in medicine. And I think most people will benefit from. I highly recommend journaling, even if it's just a tiny bit, because it allows you to see where you're going a little more clearly than if you just put your blinders on and go straight through medical school and hope for the best.
Gotcha. And I like what you said about just writing down a few lines if you didn't have time, because I think some people think of journaling as just, sitting in a corner with a blanket on your legs, filling in page after page. And if you can just get the core thought, the core feeling down, of what you're going through. And I know I interview a lot of mental health people and a lot of coaches, and so many recommend journaling as a outlet, as a way of healing even. Did you journal when you were a child, or did it start when you were in medical school?
It started in childhood for sure. At first it was when I was really young, it was like I would write songs.
Mm-hmm. I did the same.
Or little poems, like I thought I was so musical, and I actually can't carry a tune to save my life, but it doesn't matter. It was the idea behind it, right?
Gotcha.
And then when I started high school, I promised myself I was going to write in my journal every day for 1 year. And I did, January 1 to January 1.
Wow.
That was my freshman to sophomore year. So you can imagine how very deep these thoughts were. But it was pretty exciting to find that I could do it. Mm-hmm. And I think that was the gratifying thing from that exercise. And from there, I have always had a journal of some sort, even if it's not every day. I just think it has always helped me process and think and grow.
Do you still have that freshman journal?
Oh gosh, it's actually like I think it's like 9 or 10 books. Yes, I do. I have all 10 of them. I have no idea why. It's really hard to part with things you've written, even when it's just bleh.
I agree. I'm not a big clutter person, but when it comes to documents, my journals, things I've written and not published yet and may not ever publish, they are just treasures to me. And I hope someday that my kids might want to read them, if not my grandkids, but it's history. And even for you to look back at that, what would you tell your younger self? We asked, but what would your younger self tell you? Because sometimes there's some really profound poetic thoughts there because they don't have all the constraints of what if and this happened to me and all the baggage, just those wonderful open thoughts, which is why I love being around younger people because they still believe good things can happen.
It's true. That may have swayed my decision to go into pediatrics somewhat. And, you bring up a really good point, which is that if you're journaling with the idea that it's going to be for posterity, you're going to edit yourself. You can't journal with the idea that your future kids are going to read this. I think it's really important to write unselfconsciously and just get it all out there, because what often happens, I call that writing for discovery. And I write a blog for my medical group. So every week I submit an essay, and every time I sit down and start writing one thing, and then it goes in a totally different direction than I thought. And it's only because I allow that to happen that I actually stumble on some decent essays. And I think that's really important in journaling too. You have to be unselfconscious, and you have to be willing to burn it at the end. If that's what you need to promise to yourself, great. You're going to burn it. So just put whatever you need to out there. I also agree with you. It's kind of nice to look back at them eventually, but there were a couple years there where I think everything I wrote was about boys. So we probably could burn all of those.
A typical teenager. I think they occupied quite a bit of our time. I even think about just the phone conversations. I was like, what on earth were we talking about for hours and hours? Oh, I'd love to have that time back. But right. I'm sure it served its purpose in building my vocabulary and ability to speak with others. I don't know what, but it is amazing how many people come on this program who are as accomplished as you, who actually have that as a practice or have had it as a practice. I don't know how that outlet serves toward pushing you toward your goals, but I've certainly heard it frequently enough that I think there's a parallel there.
Well, I think, my feeling is, and I think this is an important concept, is that we always have the ability to grow, right? So as adults, it's a real mistake to think that we are who we are, because I don't think that's true. And if we're always trying to become a better version of ourselves, then that process requires a certain amount of introspection and self-review and self-examination, as uncomfortable as that might be. So I think the reason that you hear about it so much is that it's a big part of finding any kind of transformation. And it doesn't have to be the dramatic, 30-day, whatever. It's just the gradual process of bettering yourself, of becoming somebody better, hopefully every day of your life. Because if you stop growing, what happens?
Yeah, things that don't grow are dead or inanimate. Right. And we've all had dinner with inanimate people. So it's just not a good way to spend an evening of your life.
No, that's true. That's true.
So to make sure I got the answer to the question, for those who are currently in med school or considering it, to just go in eyes wide open and heart wide open and, enjoy the journey, or it's not for everybody, or I want to be clear on what your advice is.
My advice is not to give up your other passions in favor of medical school.
Okay.
That you need to keep those other pastimes going and those outside friendships going to remind you of who you are or who you have been on the journey. And my other advice is to journal if you have it in you whatsoever, so that you kind of check in with yourself periodically. I was really fortunate in medical school. I had a group of friends who developed out of a course called The Healer's Art. This was curated by Rachel Naomi Remen. I don't know if you've heard of her. She's author of Kitchen Table Wisdom, and she ran a retreat center called Commonweal. But she put together a medical school course that was really intended to prevent us from burning out. And from that group, from that larger class, we developed a group of, I think there were 8 of us at one point, and we dwindled to, I think, 6. But we continued to meet monthly through all of medical school. And it was just our emotional check-in with one another.
Mm-hmm.
And it was so valuable. So even if I hadn't been journaling, I had this group that was there for accountability, for us all to check in and say, hey, how are you doing emotionally with this? How are you doing emotionally with this other thing? Because what you go through in medical school has to be transforming. You're seeing people die. You're seeing people recover, but barely. You're seeing people operated upon. You're seeing bad things happen. You're also seeing amazing moments. I mean, you're seeing or participating in births just as much. And you're experiencing that discomfort of putting on this white coat and holding responsibility for someone else's health or someone else's life before you really feel qualified to do so. All of those things are really cause a lot of psychic discord. And if you're not going to journal about it, you've got to have a group of people to check in with about it so that you can feel confident you're staying true to who you want to be at the other end of the road.
Got it. That's good. And it's interesting as you were describing that advice that you would give. I was thinking, and it was succinct and poignant. I was thinking that just goes for relationships, that going into school, it sounds very much like going into a relationship. Don't give up on your individuality, on your friends, on your passions, continue to be your whole self. So that's good advice for you folks out there for whatever journey you're about to embark on, particularly those very challenging ones, whether you're trying to get a certification or a degree or start a business, is to make room, make time for yourself and for your friends and family.
What a great point.
It seems like medical school may change a lot of people, but I'm wondering, since you were able to use that right side and left side of your brain in very magnificent ways, do you feel like you stayed pretty balanced, or did it change you a lot?
I don't think you can get through medical school and not be changed. I think that is absolutely impossible.
Okay.
But I think I came through it feeling comfortable with the changes that I went through.
Nice.
And having the ability to give myself some grace over the things that were difficult about it, and the growing moments that have to happen along the way.
We're talking about burnout of physicians. Is there a lot of burnout of students?
You ask an excellent question. I'm sure that there is some degree of burnout. It kind of depends on your definition of burnout.
Okay.
I do think that there's quite a bit of psychological trauma that happens in medical school, depending on where people train and how their programs are run. Unfortunately, there are increasing rates of physician suicide. There are also increasing rates of medical student suicide. So we know that we are not meeting the emotional needs of all of our trainees or our physicians. Burnout is one of those tricky topics. And I don't know if you've heard the term moral injury, but in many cases, I think that may be a more apt term to use. Okay. So the idea behind that is that for many of the physicians who are suffering and having a really difficult time, it's because we went into a field with one ideal of how we were going to be able to take care of our patients, what we would be able to provide for them. And we entered a medical system that doesn't support the kind of medicine we were trained to practice or that we want to practice. And those feelings, whether you want to call them burnout or moral injury, really come from feeling that we are not able to be the people we trained to be. We're not given the autonomy we trained to have. And we aren't given the tools that we need to be the best physicians or clinicians that we can be. So when you force someone to, and this can happen in any field, I imagine, but you force someone to work in a way that is against their values for long enough, that's quite psychologically damaging. And so you can call that burnout. But I think that moral injury is a more recently coined term. And I consider it to be an apt one, at least in my experience. The people I know who are burning out because they are morally at odds, or they're feeling that they are not able to practice medicine the way they want. They're having to see too many patients, and then they're having to document till all kinds of hours of the night, and they're not seeing their families, and they're not getting exercise, and their needs are not being considered in the equation. And then they come back the next day and they're expected to do it again. That's not ideal medical care for anybody. And it's not ideal care of the people who are providing that care. So sorry, I went on a little tangent with that burnout moral injury.
That was a great tangent. I was not familiar with that term, and I do this. This is my own master class to learn. I love from every guest. I walk away, and I told you when we talked, I want people to leave with added value to their lives, and that includes new terms and new concepts. So thank you for introducing that to me and whomever else. And if I was the only one who didn't know, then so be it. I'm okay with that. That's how I changed, is that I am okay with not knowing everything. And I mean, how boring would that be?
Right. And that's the growth mindset, right? You've got to be able to grow and change and learn, and not be afraid to be wrong or be ignorant in order to be able to do those things.
Hallelujah. Your writing has been published in a number of journals, and you recently published Balance, Pedal, Breathe, A Journey Through Medical School, a book about drawing on diverse experiences to retain compassion while becoming a doctor. I'd love to hear a little bit more about the theme of the book and the relationship between the human body and nature. Without giving too much away, we'll tell people how to get the book later, but if you could just share a bit about, give us a little teaser.
Well, part of the structure of the book is that I really do organize a lot of these experiences around my outdoor pursuits. So, for example, everybody knows, or many people know, that sort of the notorious touchstone experience for first-year medical students is anatomy lab, where we learn to we actually do dissect a human body. You can imagine how much psychological discomfort that will cause. And I overlay my discussion of that with my experience with the search and rescue team here in the mountains and my first body recovery. So the first dead body I touched was not the one that I found in medical school. But by juxtaposing those different experiences, I think it adds new layers and new dimensions to what I went through with that experience in medical school. Balance, pedal, breathe. You can tell that some of this is about mountain biking, and mountain biking was my most frequent escape during those years that I was studying so much. And I found it absolutely meditative, as I would just keep biking and biking and biking and trying to just get through this. But the momentum is also part of it, right? You just have to keep going to get through. So biking is one of the chapters. The one about surgery also has to do with swing dancing and riding horses. The one about pediatrics is also about being a foreign exchange student. So I was really taken in undergraduate years with the writing of Annie Dillard, and the way that she could take two completely different subjects and manage to overlay them in a way that was unexpected and refreshing. And so in many ways, my book mimics that. Probably, I'm not saying I am anywhere on the level of Annie Dillard, but that was an inspiration for the way I organized the book. So I feel that the book then has appeal to anyone who is into mountain biking or rock climbing or all these other things, and makes the medical school experience more accessible to other people by relating it to different experiences. Just like you were talking about with talking to a patient. If all I did was talk about medical school, that wouldn't be that exciting for most people who have nothing to do with medical school. Right. But by using more common experiences to explain it, I think it makes that experience more accessible. And that was my goal in writing the book.
Got it. Well, you're making me have flashbacks to the first year dental school, because we took gross anatomy, and we actually had to share. We took it with the medical school students because they didn't have enough bodies. Not enough people were donating their bodies to science. So yeah, not something I want to repeat. I don't know if they're still doing that or not. I hope not. We learned a lot, but you're right. I came out of that experience. You came out knowing that there has to be, well, one, that the human body is miraculous, but two, just the balance. It sounds like you've always been about having balance with the internal and external self, and the nature, the importance of incorporating nature into our lives. Did your family, you mentioned quite a few sports here. Were you an athlete or did you biking and pedaling and canoeing? Did your family do all of this, or you had to grow up in the country or rural area?
No, they didn't do all of that. The skiing and the mountain biking and hiking I got from them, but I think I've just always been kind of a kinetic person. I sought out a lot of different experiences on my own as well.
Nice. And do your kids enjoy these things, or are they gamers, or?
Oh, well, you know how kids are. They pick their own things.
Sure.
So yes, but they don't pick the same things as one another. So yes, I have two active kids in totally different pursuits, which is fun and keeps life interesting.
And what do they think about mom being an author and educator of fellow clinicians and with the book out? Are they aware? Are they do they think that's impressive or not so much?
Oh, they have been absolutely wonderful. They were so proud of me when this book came out and have been so supportive. I really feel very grateful. And I think that's one blessing over the fact that it took me so long between finishing medical school and finally putting the book out there, is that when I did say, okay, guess what? I need to take some steps back from doing all of the things for the families so that I can write this book. My kids were old enough to be understanding and supportive and very excited for me that I was able to finish it.
Oh, that's nice. That's nice. And then it's a family thing and not just something you did that's unrelated to them. I think that's sweet. I love it when families are involved in that way and supported. We all need support, the career, the home, everywhere we need support. And what about your spouse? How does he feel about all of this?
Well, I think that's probably the critical piece. And I was about to say that actually, is that kids follow the lead of their parents, right? And the fact that he was very supportive of it and couched it to the kids in a way that, pointed out that this was something I needed to do really helped. So I felt that I really had the support of the whole family, which is so important because for many years, the reason that I didn't feel I could return to writing was the family. When the kids were younger, it was just much harder to be able to step away.
Yes.
Yeah.
It's hard. They want and need all of your attention. Now, what you share your experiences and this information with other clinicians, and I'm wondering, are they skeptical at first when they hear about this, or are they just open to it, or what has been the reactions as you've gone about talking about your approach to healthcare and being a physician?
I'm not sure that I present directly to them in that fashion. So as a clinician communication coach, I co-lead some classes. And most of the time people have signed up for the classes because they actually realize that they could use some other tips and pointers to communicating more efficiently and more effectively with patients. So in general, I find that people are very receptive to the tips and tricks that we can offer. Because they benefit both the clinician and the patient, right? I think everybody knows that when communication is not working, nobody goes home happy, right? So it's a win-win. And I would say that that's all has been received very graciously and has been welcomed.
Okay.
Narrative medicine is more variable. Some people sign up for the classes and some people really aren't interested. I've taught some writing workshops and I've been delighted that we have 20-something people sign up, but not everyone makes time for it. So it's hugely variable. And I try to offer the enrichment for people who are interested, but nobody's forced to do any of the literature or the writing classes.
Of course not. Sure. Okay. Well, I'm glad they have the option. It's good to have options. And I'm sure some of them may be a little skeptical, but then they hear from someone else, how it impacted them and their experience and come back later. That ripple effect is a beautiful thing as well. And I really just think you put information out there for whomever is receptive and whomever is ready. And if they're not, no harm, no foul. So, well, I'm very happy that you've written this book and that you're doing what you're doing to help with the communication piece and with moral injury, because I think in 2020, if we didn't know before, we saw firsthand how challenging healthcare can be for our, physicians and the whole, healthcare team, medical care team. And I think I'm worried that with all that you guys are going through, we may lose our compassion where we're not seeing it on the evening news, the phase from the N95 mask and all the trials of trying to get supplies and the TikTok videos showing their stressful days. So my final question is, what can we do as patients to support our medical teams and provide healthcare systems?
Oh, wow. That's another big topic, isn't it? I think in our current healthcare system, I think, unfortunately, patients have to, by trial and error, find the clinician they can communicate with. I think that piece is critical to having good outcomes. And, you do in a way have to put not in a way, but you do have to put your ability to get your needs met first. And so that is important. I think that in the bigger piece, we need to be pushing back against what we're being offered. I think there isn't a consumer out there who isn't aware that their health insurance costs are going up ridiculously every year, right? And they're getting less and less in exchange for what they're paying, right? So copays go higher and their time with the clinician may be less, and the clinicians are more and more burnt out. So honestly, I think that the answer is going to be a systematic change. It's going to be something much broader than what one individual can do on a daily basis. I would ask that you, and many of my patients do this, and I can't tell you how much it means to me. If I'm running late into a room, I am well aware that that is crummy as a patient, right? My day is scheduled too. If I want to go to the doctor, I don't want it to take an hour before I can get out of there. And when a patient offers me grace for that, I can't tell you how much that buoys me, because it tells me that they value what I offer to them in the room. And I do offer every patient the same. I offer them my whole self, my whole attention. And unfortunately, sometimes that means I run behind. And that means I'm not the doctor for everybody. If someone wants to just put down their copay and get their one thing and leave, I may not be the right person for them. So that's part of interviewing and finding the right person for you. And if your doctor is running late and you can find it in yourself to offer that little bit of grace or that little bit of compassion, because you don't know what made them run late, but most likely it's someone with a medical need that needed to be tended to, that goes a long way. And we don't forget those kindnesses from our patients any more than you likely forget kindnesses from us.
Very nice. Very good advice. And people always say amazing grace, but conversely, grace is amazing. And we all need it at some point or another. So please have a little grace. And you see the waiting room is full. If you're listening, you'll hear them going from room to room and the nurses talking and the chatter. So it's a lot going on. And I prefer someone who gives me eye contact and the time and listens to me. They're not cutting me off and all of that. So that's my kind of provider. But you're right. You have to find someone who's compatible with you, because the outcomes are impacted by that relationship. So thank you for being you and for helping other providers, understand that piece of listening and how to communicate in a way that connects with us. And before we go, tell the listeners how they can connect with you online, subscribe to your podcast, get your book, Balance, Pedal, Breathe, A Journey Through Medical School.
Thank you so much, Mo. On most socials, I am at Literary Art in Medicine. That's on Facebook and Instagram and LinkedIn. You can find me at Literary Art in Medicine. I do have a website. It's claireunis.net. CLAIREUNIS.net. And the book is also on Amazon. So it's called Balance, Pedal, Breathe, A Journey Through Medical School.
Fantastic. I'll drop those in the show notes as well, so that people can follow up. And I just want to say what an amazing interview this has been. And I appreciate your time and just continued success and good grace to you, Claire Unis.
Thank you so much, Mo. I really appreciate the opportunity to speak with you. And boy, it's been a lot of fun. I can't believe an hour went by already.
I know. I looked at the time. I was like, oh my goodness, I got to wrap up because I've got 1,000 more things I want to talk about. But we'll have you back to do that. Thank you so much. And wasn't that a great program? Oh, love that episode. I enjoyed it. I hope you did too. Please remember to like, subscribe, and share. Learn more about me on my website, drmoanderson.com. That's MOE. You can read book excerpts, watch videos, learn about my services that I offer, and book me for a speaking engagement. I'd love to talk with your group, and I'd love to work with you. So until the next time, review, renew, and re-you. Thank you.